let me then bring in the other dimension of this entire debate here. Dr. Rajeev Jayadevan, as a medical expert here, do you feel surrogate advertisements can even, do you feel that cracking down on surrogate advertisements can be an effective measure at all? Because we all know the advisories, for instance, on cigarette packets, for instance, the advisories and the graphic images cover almost 70% of the packet screen. Yeah, and I'm sure everyone who smokes a cigarette is aware of the medical problems or the hazards of smoking a cigarette. Yet, I don't think that has ever had a dissuading effect on people who smoke or people who consume tobacco here. Do you feel that there is an element of hypocrisy in trying to control surrogate advertising in the first place? Or do you feel that it is something which has a very important impact in promoting the sale of such products?
As a doctor, I see people who have cancer from tobacco. I see people with liver cirrhosis from alcohol and cancers of multiple organs from both these products. And it is not just cancers. We get heart disease, we get stroke, we get impotence, which is hardly even reported by young men. And then we have indirect effects of these products. It is not just the individual that suffers, not just the patient that suffers. The family is devastated. The money runs out. That trickles down onto poor education for children. It affects the healthcare of the older people in the family, and it's a cascading effect. Now, as a doctor, my advice is limited to the patient and their family members. But a famous person's actions or words has an influence on hundreds of thousands of people, directly or indirectly. We must look at the two angles here. Now, for our viewers, I'll update a couple of positions here. There's a common misconception that drinking alcohol is good for health, and that's promoted by many people who enjoy their drink. Now, I don't have a problem with people enjoying their drink, but that's wrong advice. The position has been updated in 2023. The World Health Organization and a publication in the Lancet Public Health has shown that there's no safe limit for alcohol, which basically means even the smallest amount, it is a type 1 or grade 1 carcinogen, which is equal to radiation and things like that. Now, how many people know that? Has this message reached our people? Your question was whether these pictures on the packets will dissuade the people. I'll explain it like this. In India, our average age is 28.6. In Germany, it is 45. In plain English, it means half our population is below the age of 28.6. Habits formed at a young age decide a person's health. I have heard people argue that, hey, I smoke and drink, but it's my neighbor.
And do you agree with that view, Dr. Jayadevan, that since you say that habits formed at a young age have a massive influence, and at a young age, there's also a time where people idolize superstars, whether it be film superstars or whether it be cricketing superstars. Do you also feel that is also an important aspect that needs to be controlled?
True. While I applaud certain celebrities for promoting good social causes and good health habits, if somebody is engaging in directly or indirectly promoting harmful products, I cannot agree with that, because that affects the health of the country as a whole. Imagine if half our population is at that age, imagine what their health will be when they grow older, and imagine the healthcare cost to the country as a whole. There's a World Health Organization study that says India loses 1% of its GDP. I repeat, 1% of our GDP to diseases and illnesses and premature deaths that are caused by tobacco. Now, these are all official publications.
Absolutely.
Yes.
Absolutely startling figures, Dr. Jayadevan. I'm sorry to cut you short, but I get we have got the main point of what you're trying to say.